Hi, I'm Deborah from South Essex Slings. This video is showing the new Ergobaby Omni Deluxe carrier, and this is going to be with a small baby. So first we need to set up the carrier to fit a small baby. So with the flap here that folds onto the outside or inside of the carrier, for newborns we're going to fold it onto the inside and it buttons onto the lower button. There's a high button and a low button. So we want to fold that flap inside and button it onto those lower buttons. The second thing we do is in the waistband, we make sure that the Velcro tabs are on the middle setting, which is for small babies. As your baby's legs get longer, those tabs can get wider. So your waistband is going to go on. Fold it in so that all that Velcro is against you. And because we have a small baby, we are going to put that waistband on nice and high on your torso. Your waistband needs to go high to keep your baby's head on the hard part of your chest. As baby gets taller, the waistband can get lower down your torso. So you want it up nice and high and nice and snug, and you can maneuver each side of the lumbar pad so that it sits nice and central on your back as well. Then I'm going to show you how to use this in rucksack strap. So with the clip that joins the straps together, if you clip that first and then loosen off your shoulder straps so they're nice and loose and baggy and that clip is clipped together, then we'll get your baby. Now, you want to sit your baby nice and central on your chest, encouraging their little hands up by their face and encouraging their knees to tuck up as well. So they're in that nice deep-seated squat position. With babies being put in carriers, we don't want to sit their bottoms on top of that waistband. It's quite hard to get them into a good position this way, and it's quite uncomfortable for them. This label is quite a good visual. We want baby's bum nearer that label. So you don't sit them on the top, you drop their bum slightly lower over the top of that waistband and then bring that carrier up and over their back. You don't want the top of this coming any higher than baby's earlobes. So if you are finding that that is coming too high and you can't get your waistband any higher up your body, your baby isn't big enough to fit in it yet. This tends to fit within the first few weeks rather than truly from birth. So just keep trying it with your baby. It might be 4 weeks, 6 weeks, 8 weeks, depends on the height of your child. But you want the top of this carrier coming up to baby's earlobes, so it's supporting their neck but not trapping their head in. Once you've got baby in, find that clip and pop that over your head like a t-shirt, and then bring your arms out so that the padding sits on the top of your shoulder and the webbing comes under your arm. And then push any slack backwards over your shoulder and tighten by these straps on the sides pulling backwards. And then at some point you'll find your there's no more slack coming, but it still doesn't feel tight enough. So this point, we really need to pull that slack round towards the front before tightening through some more. Pulling that slack round and tightening through. That helps to prevent baby getting splatted against your body, but all the slack still staying up here. It's just a tricky thing with the backward pull. So you just need to bring that slack forwards and then tighten through. And that keeps it much more snug fitted to you and snug fitted to baby without interfering with their body position. Once baby's in, we'll check their safety. We check that their head is high on the firm part of our chest to keep their airways open. We check with a quick glance that we can see baby's airways. Their nose and mouth is clear and visible, and they need to be nice and snug against you so they can't slump or fall. So they need to be high, tight, and in sight to be nice and safe with their head out of the top of the carrier. For your comfort, that back strap somewhere around armpit level. Most people tend to find the most comfortable. If it's coming up too high, it will pull through your shoulders and not be very comfortable at all. I have a separate video showing the placement of the back strap and a separate video for where waistbands sit as well, if you want to watch those. But keep baby safe, keep yourselves comfy, and then when you're ready to get baby out, there's a few options. One hand on baby. If you can reach that strap on your back, you can unclip that. If you can't, you can unclip the sides, and these have a triple lock here, so you need to pinch these and push that at the same time. So you can do it with one hand, or you can reach around and do it with two hands. So you can unclip there or unclip on the back, and then you can release baby, pop them down, and then pop your waistband off. Check out my other videos for bigger babies on the front and back carries and facing forwards as well. If you have any questions about this carrier or any other, please reach out. I'm always happy to help.